how OCD can present differently in different individuals. I want to talk about this topic in the video. So I just consulted a patient who is a software engineer by profession, and his primary symptom was that he gets a lot of doubts. So he is a coder, he codes, and whenever he makes a code, whenever he writes a code, he gets this doubt that there might be a mistake in it, and he checks it. He checks it repeatedly, and while checking, if he gets any other random thought, he would again get this feeling that the checking process got disturbed, and he would start over again. So the checking process or the checking procedure would take hours of time, and because his work was in conjunction with many other professionals, the working of the entire team was getting impacted or is getting impacted because he keeps on checking. I have also consulted another engineer. His main concern was that whenever he writes a mail to his senior or to a client, he gets the doubt that did I write an obscene word? Did I write a bad word in the mail? Now he knows that he has not written it, but the doubt would come in his mind again and again, and he would repeatedly check his mail to ensure that he did not write something which is obscene. Contrast that to another patient that I saw who was a shopkeeper by profession, and his symptom was in the evening when he wanted to shut the shop. While closing the shop, putting the shutters down, he would get the doubt that did I do it properly? Did I lock the door properly? And what if I forgot to lock the door properly and somebody comes and steals the stuff? So he would repeatedly check the locks. He would again have the same problem. While checking the logs, he would not get that confidence that he has done it properly, and sometimes he would resort to calling his wife and making her check the log, and only then he would feel comfortable. So the point that I'm trying to make here is all these three patients, if we talk medically, all three of them have OCD, and they have the same type of OCD. Their obsession is pathological doubt followed by compulsion of checking. But because they are in such different professions, their presentation is very different. The good thing is all these patients can be treated. When we treat OCD, we follow a very standard, fairly standard protocol. We start with medications, we increase the dosage of medication, we add therapy sessions, and a combination of these things is usually good enough to bring significant improvement. But another thing that happened in this patient, I would like to share that also. So I started this patient on fluvoxamine, which is a very commonly used drug in OCD. Fluvoxamine is a SSRI. And although it's a very good medication, in some people it causes sleepiness. So this particular patient had consulted me like 6-7 months back. At that time, I started him on fluvoxamine 50 and increased it to 100 mg. He started having the side effect of excessive sleepiness. But rather than coming back to me and telling me that he's having this side effect, he believed that the medications are going to cause side effects. Anyways, people have this thought in their mind that all psychiatric medications are sleep medications, and they are sedative in nature. And so he also decided that this medication is causing sleepiness, and I would not be able to work properly if I continue on this medication. He stopped it. Fast forward to today, 6 months have elapsed since then. The symptoms have worsened, and now we are starting the medications all over again. So the point I'm trying to make here is that whenever as a doctor we start a medication, we start at a standard dosage. A lot of patients would not experience any side effect, and for some there might be side effects like acidity, some gastric problem, some excessive sleepiness. If that happens to you, rather than stopping the medication, you should go back to your doctor and tell the doctor that, okay, this is the side effect that I'm experiencing. If this patient had come back to me, I would have decreased the dosage, or I might have shifted him to something else, but I would have found a solution, and in all likelihood it would have worked. But by presuming that the medication side effect is something that cannot be controlled and stopping the medication, all the patient achieved was interruption of the treatment. So that doesn't help. Whenever you see a psychiatrist, whenever you start a medication, I understand that you have certain doubts, but you have to keep the communication open with your doctor. If something happens, go back to your doctor, tell this is the problem, let them find a solution. So the purpose of this video are twofold. First, different people may have different presentations of the same illness depending on what they do. And secondly, when we start a medication, have some patience. The illness that has been there for many years would not get solved in 10 days or 15 days or a couple of weeks. It takes time. It takes time for us to find the right medication and the right dosages. And if you give your doctor this time, things would start going into the right direction. So an illness like OCD has very good treatment nowadays. Medications work, therapy work, both of them work together very well. But you have to take the initiative and you have to see the psychiatrist nearby. So if you or one of your family members or one of your friends is having these symptoms, please don't ignore these symptoms. By ignoring the symptoms, the problem would not go away, it would only get complicated. Seek consultation from a psychiatrist nearby, start the treatment, and get back and try to get back to a normal life that you deserve. Thank you.